Imagine this for a second. You're heading into a hospital, maybe for yourself, maybe for someone you care about, and there's this fundamental trust there, isn't there?
Mm-hmm.
You believe you're in the safest possible hands, that every single thing, every procedure, every pill is just, perfectly managed for your health.
Right. That's the expectation.
But the reality, and it's kind of surprising, maybe even a bit jarring, is that medical errors, things that could be prevented, are a huge global issue, often hidden, but with very real impacts.
Yeah, absolutely. It's a paradox, really.
So welcome to the Deep Dive. We're your shortcut to getting a handle on really critical topics. And today we are diving deep into how the world is really trying, to make healthcare safer for everyone.
We've got a range of sources here looking at the global picture of patient safety.
Yeah.
Everything from information systems, research efforts, to risk management strategies.
And our mission today is to really unpack where things stand, what's working, where are the big hurdles still.
And what really jumps out from the sources is, well, despite a lot of initiatives popping up everywhere, there's this ongoing lack of really good, comprehensive information systems. We just don't have a full picture.
Hmm.
If you look at the overall score globally for how countries are doing on patient safety efforts, information, research, risk management combined, it's sitting at 44 out of 100.
44. Wow, that's pretty low. It tells you there's a massive amount of work still needed, doesn't it?
It really does, especially in shoring up research in those information systems we mentioned.
And I guess that score hides a lot of variation, too.
Oh, definitely. Efforts vary wildly depending on the region, a country's income level.
Mm-hmm.
Generally, you see high-income countries with more established setups. But that 44 average, yeah, it signals a lot of room for improvement globally.
So it's about learning from mistakes, trying to measure the right things, and maybe using tech to build a safer future. That idea of a learning health system seems key.
Exactly. And that's a great place to start. Let's dig into those basic building blocks, the reporting and learning systems.
Right, because you have to capture the problems to learn from them. I always think of the airline industry here. They're like the masters of learning from errors, right? Making flying incredibly safe.
They really are.
Yeah.
And healthcare is trying hard to adopt that same mindset.
Mm.
We must learn from the things that go wrong. It's fundamental.
So how do we structure that learning? Is there a guide?
Well, the World Health Organization, the WHO, they've put out some vital frameworks. There's a conceptual model for classifying incidents, just to get everyone speaking the same language about what happened.
Okay.
And they also developed what they call a minimal information model, MIM, for short for reporting. It's meant to standardize the data you collect, either a basic set of 8 key things or a more advanced set of 10.
A blueprint, basically. It sounds sensible. But what's the reality on the ground? Are countries actually using this?
Well, that's the reality check, like you said.
Yeah.
The sources show about 70% of countries have set up some kind of reporting system. So the intent is there. But only about a third of actual healthcare facilities are actively participating in those systems. And maybe more critically, only about a third of countries are actually aligning their reports with that WHO minimal model.
So we've got systems, but they're not widely used, and they're not speaking the same language. That's a huge barrier to learning globally, isn't it?
It's a massive challenge for interoperability, for sharing lessons learned. Absolutely.
And what kinds of things are supposed to be reported? Is it just the really serious stuff?
No, and that's what's interesting. These systems are designed to capture a spectrum. You have near misses where harm could have happened but was caught just in time, like spotting a wrong blood bag before it's transfused.
Okay, makes sense. Learn from the close calls.
Right. Then there are no harm incidents. These actually reach the patient, but thankfully don't cause any obvious harm. Maybe the wrong blood type was given, but it happened to be compatible. Still an error, still worth learning from. And then, of course, you have harmful incidents, where the patient is directly harmed. The systems ideally capture all 3.
And do they? Is that happening?
Well, about half of countries report they do capture near misses and no harm events. But here's a key finding. High-income countries are much, much better at reporting these less severe incidents.
Which suggests maybe a more mature safety culture. Less about blame, more about spotting any potential issue.
Exactly. It points towards a culture focused on learning from any deviation, not just waiting for a disaster. It's more proactive.
So once these incidents, whatever type they are, get reported, what then? Does it actually lead to change?
That's the goal. Proactive prevention. About 27% of countries say they regularly send out patient safety alerts based on what they're seeing in the reports.
Can you give an example?
Sure, NHS England has a national system. They spot emerging risks from the reports, work with frontline staff and patients to figure out solutions, and then issue national alerts telling hospitals, okay, here's a new risk we've seen, and here are the specific things you must do to mitigate it.
So it's a structured way to close the loop, from report to analysis to action.
Precisely. It's about making sure the learning actually translates into safer practices.
Let's look at some real-world examples. Our sources mentioned Thailand.
Yeah, Thailand's interesting. They built their national reporting system, NRLS, on top of risk management systems already in their hospitals. It's voluntary, but they've got buy-in from 950 hospitals. That's like 67% participation.
Wow, that's pretty good for voluntary. What's their secret?
Their big focus seems to be on building a culture of trust and good reporting, making people feel safe to report. There's a great quote from someone involved. Everybody owns this system, everybody can report into it, and everybody can use the data.
That sounds powerful. Real ownership.
It really does. Now contrast that, or maybe complement it, with South Africa. They took a different path initially.
How so?
They standardized their system using the WHO classification and rolled out a web-based version back in 2018. And compliance shot up from 37% to 69% in 5 years. Huge improvement in reporting rates.
Okay, so standardization and tech helped there. But I sense a but.
But the sources highlight that staff are still, and I quote, very scared of being disciplined, which means severe incidents. They're likely still being underreported.
Ah, the culture piece again. Even with a good system, fear gets in the way.
It's critical. They're working on creating a blame-free environment
Right.
where, as they put it, facilities understand that having a high number of incidents is not indicative of poor care. It might actually mean you have a good reporting culture.
That's a tough shift to make culturally. What about tech? England and Wales were mentioned too.
Right, they're really leaning into technology.
Yeah.
Their existing system, the NRLS, gets something like 2.4 million reports a year. Massive volume.
Whoa.
And they're moving to a new system called LFPSEA, Learn from Patient Safety Events. The interesting thing here is the taxonomy, the classification system. It's designed to dig deeper into how things went wrong.
So not just patient fell, but why they fell.
Exactly. Was it poor hydration? Wrong shoes? A medication side effect? Maybe the ward layout? That level of detail is crucial for designing targeted interventions.
Makes sense. You can't fix the problem if you don't know the root cause.
And they're going further. They're using AI, machine learning, to sift through all those reports, trying to spot new types of incidents, prioritize reviews. The hope is to pick up some lower harm incidents before they cause more severe harm.
Using AI to find the weak signals in the noise, that's fascinating.
It is. But they also caution that, the temptation is just to collect tons and tons of data. You need a solid plan for how you're actually going to learn from it.
That's the key, isn't it? Turning data into actionable insights. How do you ensure that happens, especially with something complex like AI?
It means designing feedback loops right into the system. AI spots patterns, but you still need human experts for context, for the deeper dive, making sure it leads to real change. The ultimate goal, they say, is making anonymized data accessible and useful for everyone.
So, for you listening, these reporting systems, they're kind of the unsung heroes working behind the scenes. They're trying to make your next healthcare experience safer by learning from mistakes, big and small. Okay, let's shift gears. Segment 2, measuring what matters. We're talking information and surveillance systems now. Why is measuring patient safety performance so important? Seems obvious, maybe.
Well, it seems obvious, but it's incredibly hard to do well. Measuring is how we actually know if we have a problem, right?
Yeah.
It lets us set benchmarks, see if our safety initiatives are actually working, track progress, and change course if needed.
But it's complex.
Very. And that data dilemma we touched on earlier, it's profound here. There's just a persistent lack of high-quality, comprehensive data globally. What we have often gives just a fragmented picture.
What are the main challenges? Still the fear of reporting?
And that's definitely part of it, underreporting due to fear, but also issues with data quality itself and a real lack of standardized metrics. Everyone measures things slightly differently, which makes comparing performance, say, between countries almost impossible.
Like comparing apples and oranges constantly.
Pretty much. It's like trying to build a global picture using puzzle pieces from completely different sets.
So despite these challenges, what are countries trying to measure?
Well, about 3/4 of countries have actually identified some patient safety indicators, things they want to track. But only about 25% have effectively disseminated these indicators down to the hospitals and clinics for actual monitoring and reporting back up.
So the indicators exist on paper for many, but aren't necessarily being used system-wide.
Correct. And the types of indicators measured vary too. The most common ones you see are healthcare-associated infections, medication errors, and hospital readmissions. Those pop up frequently.
Is there a pattern based on income level, like with reporting?
Yes, very much so. Higher income countries tend to monitor a broader range of indicators, often tackling more complex issues like polypharmacy. That's the risks associated with patients taking multiple drugs. Lower income countries, understandably, often focus their measurement efforts on really critical, high-impact areas like infection control. Basic, essential safety.
And is this measurement data actually getting integrated into the bigger health picture?
That's another gap. Only about a quarter of countries fully integrate these patient safety indicators into their main national health information systems, the CON-ISS.
Why does that integration matter so much?
Because integration ensures regular reporting and analysis as part of the routine health system monitoring. It means safety isn't siloed. It's part of the main dashboard, allowing for better trend analysis and more informed national decision-making. Without it, safety data can just sit there unused.
Okay, so standardization and integration are huge challenges. You mentioned earlier something that could be a game changer, ICD-11.
Ah, yes. The WHO's International Classification of Diseases, version 11. This really is poised to revolutionize patient safety data, or at least provide the foundation for it.
How so?
It includes, for the first time really explicitly, a model to capture harm associated with healthcare. It looks at three things. The source, was it a drug, a device, a procedure? The mode or mechanism, how to go wrong? An overdose, a perforation during surgery, a wrong site? And the consequences, what was the actual injury or harm to the patient?
That sounds incredibly detailed.
It is. For medication incidents, for example, it can help distinguish between giving the wrong dose or at the wrong time or the wrong rate or just the completely wrong drug. That level of granularity is what you need to design effective ways to stop it happening again.
And you mentioned it could help with diagnostic errors, too.
Yes, which are often underreported, but affect, according to the sources, maybe 1 in 10 diagnoses. ICD-11 provides better ways to code these issues. This kind of standardization, hopefully, will reduce that data fragmentation we talked about and unlock insights, maybe even using AI down the line.
So that's about classifying incidents. What about broader surveillance, looking beyond just individual reports?
Right, that's where patient safety surveillance systems come in. It's about gathering intel from lots of different places to spot risks. Think internal sources like safety walk-rounds where leaders check on safety practices, focus groups with staff, digging into medical records.
Okay.
And also external sources, malpractice claims data, pharmacovigilance that's tracking drug safety after they're on the market, hemovigilance for blood product safety, tracking healthcare-associated infections more broadly.
A whole ecosystem of safety information. But is it connected?
That's the catch. Only 11% of countries report having comprehensive information sharing between all these different surveillance streams and the main incident reporting systems. Again, silos.
So much data, so little connection. And what about investigating the really serious stuff, the never events?
This is another critical point. Only 23% of countries globally say they have a robust, independent system to investigate severe harm. And those never events, things like wrong site surgery, that should absolutely never happen.
Only 23%. That seems low.
It is. But what's even more striking, maybe shocking, is that 0 low-income or lower middle-income countries reported having such an independent investigation body.
None.
None reported. This points to a major equity issue in safety oversight worldwide. The safety net has huge holes, particularly in less resource settings.
Are there models for how this should work?
Yes. Countries like the UK have their Health Services Safety Investigations Body, HSSAB. Key features are that it's independent, investigations are non-punitive, the focus is solely on learning, not blame. They bring in diverse expertise, even from aviation, and they share their findings widely to promote system-wide learning.
So pulling all this measurement and surveillance together, how does it help you, the patient? Ireland was mentioned as trying something holistic.
Yeah, Ireland's working on a quality and safety signals program. The idea is to pull data from multiple sources, incident reports, patient experience surveys, clinical audits into online dashboards.
Trying to connect the dots.
Exactly. To maximize the intelligence you get from all that data collection, create sort of composite safety profiles, spot national issues needing alerts. basically ensuring that the, quote, huge amount of time collecting and submitting data actually leads to insights and actions that improve care at every level, making the data work harder for safety.
Okay, fascinating. Let's move to our final segment, future forward looking at research and digital technology. And this kicks off with what you called a research blind spot. What's going on there?
It's pretty stark, actually. The sources show only 11% of countries regularly flag patient safety as a national research priority.
Only 11%. That's surprisingly low given the scale of the problem we've been discussing.
It gets worse. Even fewer, just 6%, actually allocate sufficient resources for patient safety research. And in low and lower middle income countries, a staggering 84% say they haven't even started allocating specific resources for it.
Wow, so we're not systematically studying the problem in most places.
Largely, no. And furthermore, only 29% of countries report using research evidence when it does exist to actually inform their patient safety policies and practices. That number drops below 10% in the African and Southeast Asia regions.
So there's this huge disconnect. We know safety is an issue, but we're not prioritizing research to understand it better or using the evidence we do have to fix it.
It fundamentally limits our ability to develop effective, evidence-based solutions globally. It's a major gap.
Is there any bright spot in the research and policy interface?
Well, one promising area is integrating safety into how we evaluate new health technologies. About a quarter of countries are fully integrating safety risk assessments into their health technology assessment or HTA programs.
So when they're looking at a new drug or a new surgical device, they're asking about safety right from the start.
Exactly. Building safety in by design rather than trying to fix problems after the tech is already out there. It's a proactive approach.
Okay, now let's talk digital. Electronic health records, EHRs. These are often touted as a huge win for safety, right?
Oh, absolutely. They're seen as a potential game changer, and for good reason. They can streamline how medications are managed, give doctors quick access to your full history, improve communication between different clinicians.
Aid diagnosis, too.
Yes, aid diagnosis provides clinical decision support like alerts for potential drug interactions, and even empower you, the patient, through portals where you can see your own records, test results, etc.
So what's the adoption like globally? Are EHRs everywhere?
Not quite everywhere, but uptake is significant. About 26% of countries report they have fully integrated EHRs across all main healthcare processes, outpatient, inpatient diagnostics. But a much larger group, 65%, report partial usage.
So a mixed bag, some fully digital, many somewhere in between.
Exactly. You see everything from countries just starting to develop EHRs to those with advanced nationwide systems. And different approaches, too. Some mandate adoption, others leave it voluntary.
But just putting in tech doesn't automatically make things safer, does it? There can be new kinds of errors, right? Tech-related errors.
That is the crucial flip side. Technology introduces its own safety considerations. And here's another concerning stat. Only 21% of countries conduct thorough safety evaluations before and after they roll out new digital health tech.
Only 21%. So most places aren't systematically checking if the tech itself is safe to use in practice.
Or monitoring it closely afterwards.
Right.
Only 22% have set up specific surveillance mechanisms just to watch for safety issues arising from digital health products like EHRs or diagnostic software.
So we're rolling out powerful tools without always having the safety checks in place for the tools themselves.
In many cases, yes. Though some countries, like Singapore, are highlighted as having really stringent guidelines, IT security, governance, proper evaluation before and after deployment, and specific monitoring for EHR-related incidents. But they seem to be more the exception than the rule globally.
It raises that big question, doesn't it? How do we innovate rapidly with digital health, which has so much promise, without accidentally creating new ways for things to go wrong?
That's the tightrope we have to walk, balancing innovation with rigorous safety assurance.
And for you listening, as tech gets woven more and more into your healthcare, knowing about these safety evaluations, or the lack thereof, helps you understand those hidden layers of protection or potential vulnerability. It's about trusting the tech as well as the people. Okay, let's wrap this up. We've taken quite a journey here, a real deep dive into global patient safety. We looked at the reporting systems, trying to learn from errors.
The challenge is in actually measuring safety performance consistently.
And finally, the future, the gaps in research funding and the huge potential pitfalls of digital health, like EHRs.
We've definitely seen progress, like more countries setting up reporting systems, EHR adoption growing.
But also some really critical gaps. That research funding is a big one, and ensuring digital tools are implemented safely everywhere. And that global performance score of 44.
Yeah.
Yeah.
I think the big takeaway, really, is that patient safety isn't a destination you arrive at. It's a continuous journey. It requires constant learning, adapting, collaborating.
Building trust seems vital, too, based on what we saw in South Africa and Thailand.
Absolutely. Trust, standardizing data so we can actually compare and learn globally, and crucially, using every scrap of information from near misses to surveillance data to actively prevent harm. It's an ongoing process.
So here's a final thought for you to chew on, something to mull over after listening. If every single patient safety incident, even a near miss, is fundamentally a lesson waiting to be learned, how can we as patients, as family members, as advocates, just as citizens who use the health system, how can we better contribute to building a truly learning health system? One that doesn't just report problems, but actively uses those lessons to make care safer for absolutely everyone, no matter where they live.